Our next presenter is Vicky Booth, and Vicky will join us. Vicky is the director of the Autism Hub and Reading Centre. Is that correct?
Not quite, yes.
Nearly. Thank you. Would you like to come up and join us for your presentation?
Thank you.
You're going to talk a little bit about what ECHO looks like in action.
Yes.
Fabulous. Thank you.
Yes. And I'm really happy to be here, and thank you for staying to the death. I really appreciate it. I literally have flown in for just 2 hours for Melbourne, and then I'm back on a plane as soon as I finish. So I appreciate that there are people here to actually listen. Edu-ECHO is what we're calling our version of Project ECHO for a collaborative, innovative project between the Department of Education in Queensland and Queensland Health. So I'm going to introduce you a little bit about that today, because a lot of other departments of education around the country are asking us how this is happening, how we are doing this work, and I'm really hoping that I will inspire other people to go and talk and integrate between government agencies. It works. So just to introduce who I am, because I know that I'm not probably very familiar to any of you in your space. So I'm actually the Director of the Disability and Inclusion Branch for the Department of Education in Queensland. And I have the carriage of a project called the Autism Hub. In Queensland, the Autism Hub is the one-stop shop for parents, educators, and all of the autism community across Queensland. We're a statewide cross-sector service looking after young people from 0 to 18 years. And our job really is to build the confidence and capability of educators to include, engage and retain students with autism. So this was a really exciting project for us to be a part of. And the reason why we became involved was because as the director of the Autism Hub, I sit regularly with all of the CEOs for every autism-specific service or provider in Queensland. We sit round the table once a month and we talk about the services that need to happen to enable the autism community to function and to collaborate together. Part of that is the Queensland Children's Hospital, and we talk about all of the things that need to happen to support the autism community. In fact, the reason I'm here for only 2 hours today is because, if you haven't known, in Queensland at the moment we are on fire in a big way. And so my whole life at the moment is actually about providing resources for children in refuges who have autism, supporting their families, providing support for teachers and resources for them to know what to do to improve the sensory needs for children with autism in schools at the moment. So I'm a very wanted woman, and certainly that's part of the work that we're doing with all of the autism community. I might skip that one because I know we're running short of time. Our problem statement really is this. We have 90,000 teachers in Queensland state schools. We have 20,000 children with autism who are predominantly educated in their mainstream local school. And so our job is to build their confidence and capability, and that comes with resources, and it doesn't come quickly. So we have 7 autism coaches who work across our state, and so our job really is to run workshops, build resources, do webinars and work with them. Currently, these are the numbers that we've been able to professionally develop in this year, which is not a huge amount because they're all face-to-face. When we came on board with Project ECHO, we were then able to start to look at doing bigger numbers, and we were able to influence the way that they received their information. Oh no. There we go. So you've just heard Dana talk about the weekly sessions. This is a game changer in education. This is absolutely a game changer. We at the Disability and Inclusion Branch have led this work, but certainly I was talking to someone out in the hall earlier who the other branches within the Department of Education are clambering to get onto this project. The idea for us was to allow our frontline staff in education to have access to multidisciplinary health and education support. This really came very early on in the year when I was supporting a principal in a school who had a young person with autism who is what we call this in the suspension loop. Suspension loop is when a young person is constantly back at school for a few days and then there's a behaviour or an incident and then they're suspended again and they're suspended again. The school was really struggling to engage him and to keep him at school, and I know that would be a regular and very familiar story that you would hear. But also that the family and the health practitioners who were working with this young person were not collaborating and working together. And so when we started to talk with Queensland Health about this young person and do a case management wraparound care, we actually were able to support both the family and the young person, but also the school to build their own knowledge around what it was that they needed to be looking for. It was incredibly powerful. I'm very proud to say that that young person who was actually on a trajectory for exclusion has now been very successfully re-enrolled back in that school, and the staff are very well supported. We could not have done that without the help of Queensland Health. So our aim is to really build a professional learning community where teachers, and this is the difference in our model, I suppose, and I know that there were some questions about that, where teachers and educators can actually ask questions, can hear from a multidisciplinary panel about some of the things that are going on for the young person in their care or their education care, and will be able to get some answers and feedback, some understanding about what it is that they need to do to change their practice. We want to mature the partnerships between health and education experts. We don't want to be seen as parallel care providers. We are all looking after the families and children that we have in care. And certainly this has been a strength that we've had at the Autism Hub in working with Queensland Children's Hospital. We want to make sure that we are building that learning community right across education. Our timeline has been fairly tight. We have got a service agreement for 12 months. So for the next 12 months, the Department of Education will fund up to $100,000, the Edu-ECHO, Project ECHO pilot. And that will be a development of a 6-week initial curriculum. The idea is to engage with educators across all 7 regions. And as Dana spoke, the tyranny of distance is a problem for us in Queensland. So we will be running it, making sure that it is actually a statewide, rural, remote and regional service as well as metropolitan. The scalability alternatives for us are significant, and I can only see that this will grow very, very quickly, and we'll probably have to put a bit of a lid on it towards the department because they so desperately want to work with Queensland Health. But there is definitely a transferability of the model, and I'm particularly proud of the interagency partnership that we are developing. Our goal is to make a difference, to increase our staff capability and confidence in working with families for children with autism, to increase the retention and engagement of students with autism in our school settings, and to strengthen our established partnerships. Really what we know and what has already been said today is that when we improve a child's education quality of life, that it certainly improves lifelong outcomes beyond the school gate. And so we know that this is worth investing in. We've learned lots and lots of lessons. The biggest lesson that I've learned as the director in the department is the difference in our language. Education and health language has been so different. We've had really robust and exciting conversations learning each other's language in the round we care, how we care for young people and their families. It has absolutely relied on cross-agency leadership and goodwill, and certainly we're really excited to be able to capture and evaluate and hopefully come back and share with you the amazing data that we have started to collect about how we have improved these outcomes. I have certainly been able to look at sustainability beyond the initial pilot, so we are looking at making the Edu-ECHO pilot into a business as usual, part of the Department of Education's professional offerings to all educators across the state for free, paid for by my branch. If you would like to know more, or if you want me to help you to get into other Department of Educations across this country, please contact us because I'd be very, very happy to share with them just how wonderful this is. I'm incredibly proud to work with Dana and her team and the Queensland Children's Hospital, and thank you so much for staying and listening.
Thank you, Vicky. Look, first of all, a comment, not about this, but Vicky is a remarkable individual. Just to actually take the time and join us today to do this presentation while, as she said, our state is on fire.
Yeah.
Thank you on behalf of the children and families of our state.
It's really important.
For the work that you do.
Thank you.
Does anyone have any questions of Vicky, a living and breathing example of what collaboration is about?
Hi, thanks Vicky. That sounds just fantastic. Bianca Forrester, I'm working with the Doctors in Secondary Schools program in Victoria, so 100 doctors, 100 schools. And Department of Education Victoria.
Okay.
Oh, yeah, great. So I mean, we've been in the schools for, some are 2 years, I'm 18 months, and I'm really interested as to how this might look. So what a Zoom meeting might look like in regards to who are your subject matter experts and how might you, for me this is interesting because I'm wondering how we as, health professionals learning alongside educators would look. Yeah. So if you could just explain to me what a Zoom might look like and who you might have present.
Well, it very much looks like health and education professionals sitting side by side, planning together, answering questions and being, really vulnerable in this space has really been the key. So the panel this time actually is a researcher from the local university, a Griffith University Autism Centre of Excellence, and Professor Honey Huesler, who's from the Queensland Children's Hospital. It'll be facilitated by the project manager from the Autism Hub. We also have an occupational therapist who's going to be on board. We have an autism coach who's the teaching and education part of the team. And that's just this session. The idea is to ensure that people can ask a question about all sorts of different things to do with a child with autism and get a variety of different responses, answers, questions. What does research say? What does the evidence base say? What could actually practically work in a classroom as opposed to a very medical model? So I think that's been the strength for us at the moment. But we intend to change that most terms, just depending on what the educational needs analysis tell us about the people who are participants.
Great. So every meeting's different depending on the questions asked or the experts that are in the room.
Do you want to answer that one?
Yeah, sorry.
You might be a bit more
presentation
succinct.
was so short. So each session starts with a really brief didactic component, so 10 minutes, something like that, and that's different every week. But the bulk of the Zoom, the bulk of the video conference is case-based discussions on any topic.
Right.
So for our ADHD series, we had health experts, education experts, and at the spokes, mostly health, but also some from education. We also had a consumer rep on our hub panel, so we had a parent of 4 kids with ADHD, so you can build that into it as well.
Thank you, Dana. Thank you for the question. Are there any other questions of Vicky? If not, please join me in thanking Vicky and wishing her well on her
Thank you.
swift flight back. Thank you, Vicky.